trust me when I say, don't be a skeptic.
I've organized medical camps, but I've never had a wonderful one like this one.
We shall not forget about the project.
This has been the greatest mission.
What did we accomplish this week?
One of a kind.
Feeling super excited.
But at the end of the day, this mission is only for the people. We came here to support them, to help them, to work with them, to teach them, and to learn from them.
The refugees here, I wouldn't say they are living the best life. The refugees here, what makes them unique is the kind of life they're living. They have huge unmet gap in all affairs, in the biopsychosocial aspect, holistically, socially, physically, health-wise. They are not getting adequate resources to support them. Their monthly relations, someone survives on $4 per month that they are given at the moment. That is quite too small.
We made it to Jangwali refugee settlement on the border between Uganda and Congo. This refugee center has 10 healthcare facilities. Now we are in the largest one, Jangwali Healthcare Center. The capacity of local people, it's very limited. They lack resources and skills. Jangwali Healthcare Center is the largest healthcare center in this community. It's serving around 200,000 people. It's overwhelmed. Usually on daily basis, they receive more than 500 patients.
I'm Alex, one of the point-of-care ultrasound specialists working here in Uganda. I was asked to perform an ultrasound of this woman's abdomen by the local physicians because of how enlarged it is, only to find that she has all of the features of advanced cirrhosis caused by a liver fluke that lives in the lake nearby. There's clearly a need here for rapid diagnosis, and we've been able to educate some of the physicians here, empower them to use this very accessible technology to make diagnoses faster and quicker.
So we just saw a 36-year-old male with swelling of his left leg. He had been in the hospital for about a week getting treated with antibiotics for presumed skin infection of the leg and a possible new heart failure. But using this low-cost ultrasound, I took a look at the veins of his leg and saw that he had a very, very large clot in his leg, which, if untreated, about 1 in 2 progress to move up to the lungs and cause a big blood clot in the lungs that can be very life-threatening. So after we made that diagnosis, immediately next day he was shipped out or sent to the regional hospital locally for anticoagulation therapy, and probably saved his life in the end.
This is Dr. Zohair, OB-GYN from France, with extended experience in humanitarian settings and low-resource countries. Dr. Zohair with us in this mission to provide 3 kinds of services. First of all, surgeries. Second, we'll provide consultations for patients. Third, which is more important for us, is training program with HBB. In this camp, the population of women is more than 81%, women and children, so he's raising the capacity of local midwives so they can manage the cases they got on daily basis.
These young women, 20 years old, have two children, one delivery normally and one with C-section. And coming this morning with pain and bleeding. She has sonography and they suspect ectopic pregnancy. You can see here why this sonography is doing by Dr. Alex. You can see. So you have to prepare these women to go to OT.
That mother would have actually died, but because of this intervention, this mother's life was saved. I'm so grateful to Pious Projects for the wonderful work, for the wonderful donations, for the wonderful, I didn't know how to thank this project.
The baby is in good condition. Women have some bleeding, but we manage this. And I profit on this occasion because in this hospital we have GP perform C-section. They are not surgeon, they are not gynae, so they do their best, but they need some training or some more information.
What's so great about this organization is that it's small, so it's really flexible. So every day we've been able to sort of adapt to what the needs have been. You know, we came in with an idea of what we wanted to do, and then you sort of, right when you arrive, do a needs assessment. You can know immediately what's needed, what's not, and kind of adapt based on that.
We were just here and we saw a patient come through in an ambulance. They were dropped off immediately right here, and they weren't seen for 20 minutes, which is really a big issue because their complications got worse in just that 20 minutes alone. We're here to help and resolve the issues.
We can change life here about just small things, but focus.
Exactly.
Focus in things, tack, and they change their life. They just, for example, retractor they don't have. They don't have retractor. Young doctors, they have just 6 months training in big hospital, and they work. For example, I was very happy yesterday because I trained them to ligature for arteruterine. And they do one at night, and
nice.
they save uterus of woman. It's very nice.
That's very good.
They're very open to learn, and inshallah.
Well, that's why you're here to teach them. So when you leave, the effect would stay here while we're gone.
So we brought medication with us, but the real value here is the equipment we're leaving behind with the proper staff training from all of our nurses and doctors that came with us today. We need your support to continue these type of medical camps to provide and build capacity for them to see even more patients.
So this
is our sweet baby. This is, you know, after we came here and realized how much skill and talent there is with the sonographer here, we decided that he definitely needed the highest quality machine we could get locally made. So Pius Projects got in touch with a local manufacturer of ultrasound machines and got this amazing piece of technology delivered to the clinic in Changwali. So there's no doubt that this is going to really help improve the quality of diagnosis and help patient care here. It's going to be great. Looks like about probably 8-9 guys carrying this 300-pound box with a 120-pound machine in it. They don't go.
It's a mission getting it in, but it's definitely worth every single penny and every struggle.
You'll be the superstar. Yeah.
The face can tell. So, trust me when I say, don't be a skeptic. Your money is 100% makes it to where it's needed, the most needed.
I'm so grateful to Pius Projects for the wonderful work, for the wonderful donations, for the wonderful, I didn't know how to thank this project. It's been so wonderful, so been helpful, and so great. And a team of very committed fellows working from 8 up to late in the night without eating anything but serving the refugee and the host community population. May Allah bless you so much, and may Allah never make your pockets run dry, for you have done a very wonderful job for the people.